Please, can we please put our hands together for the First Lady and Mother of a Nation as she delivers her remarks. Ruth Aguele will be
Can
doing
we
the translation.
be all seated, please? Thank you very much. You are not even ready. Shy. The wife of the Vice President, Federal Republic of Nigeria, Her Excellency Hajia Nana Shetima, wife of the Deputy Senate President, Hajia Leila Barao, members of the House of Representatives here present, including Right Honorable Dominic Okafo, Right Honorable Adamu Ashimu, Right Honorable Dr. Bulama, Right Honorable Matthew Donatus. The Honorable, you are all in the committee on, can I have the program, because I have to say it right. That's how it goes back. You are all from the committee on the House Committee on HIV/AIDS, Tuberculosis and Malaria. We thank you so much, honorable members, my former colleagues, for being here today. Thank you very much. Can we give them a hand? If not, they won't pass your budget. Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Salako, the wife of the Chief of Staff to the President, Mrs. Salamatu Gbajabiamila, wives of National Assembly members here present, wives of honorable ministers here present, the Comptroller General, Nigeria Immigration Service, Mrs. Kemi Namdap. Thank you so much for being here, and also members of your staff that accompanied you. The APC National Woman Leader, Dr. Mary Alele, Chairman of FCT Area Councils here present, the Acting Board Chairman, Stop TB Partnership Nigeria, Dr. Queen Uboji Ladipo, and other board members present. Board Vice Chair, Global Stop TB Partnership Geneva, Chief Austin Arinze Obiefuna. Country Representative World Health Organization, Dr. Walter Kazadi Mulumbo. FCT Mandate Secretary on Health, Dr. Dolakbosh Fashawe. National President, National Council for Women's Society, Mrs. Edna Azura. Traditional rulers present, including the Shakbeyi of Gariki, His Royal Highness Alhaji Dr. Usman Nga Kupi, and others that are here, and also the Emir of Sauka. Thank you so much for being here. Religious leaders here present, gentlemen of the press, ladies and gentlemen, Sonunku Dezua. I'm delighted and honored to join you all as we commemorate the World Tuberculosis Day 2025, a day set aside to build public awareness about the global epidemic of tuberculosis, TB, and to protect the health and well-being of Nigerians. Today, we are reminded of the devastating impact tuberculosis has on our communities. Yet it's also a day of renewed hope, commitment, and action. This year's theme, Yes, We Can End TB, Commit, Invest, and Deliver, with our local slogan, We Fit Duam, is a call to action for all of us. Beyond being a disease, TB is a national emergency that needs to be addressed urgently because it is preventable, curable, and also curable. The statistics from the World Health Organization 2024 Global TB Report are alarming. In Nigeria, one person dies of TB every 7 minutes. This means that in the short time we have spent at this event, many more lives will be lost if we do not act swiftly and decisively. Despite TB being preventable and curable, Nigeria remains one of the top 8 countries with the highest burden of TB worldwide. It is unacceptable that so many of our brothers and sisters still suffer from this disease in silence due to stigma, lack of awareness, and the ignorance of visiting healthcare facilities on time. As part of the Renewed Hope agenda, His Excellency President Bola Ahmed Tinubu GCFR is passionate about the health and well-being of Nigerians as essential pillars of development. Under the leadership of the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, CON, the ministry is fully committed to eradicating TB through strategic investment in diagnostics, treatment, and prevention. We are working to bridge the gap in TB detection and care on all fronts in Nigeria. The government has prioritized expanding TB testing and treatment centers across Nigeria, ensuring that TB treatment remains free and accessible to all, strengthening our community-based health care system to reach the most vulnerable populations, and enhancing funding and partnership to scale up TB control programs. However, it is important to say that government cannot do this alone. Ending TB by 2030 is a collective responsibility. We need traditional and religious leaders, legislators, the youth, healthcare workers, private sector organizations, non-governmental organizations, community-based organizations, and international partners to join forces in this fight. As the global and national Stop TB champion, I reaffirm my commitment to addressing the scourge of TB in our nation. I will continue to advocate for increased funding and policy reforms to strengthen TB control efforts and mobilize resources and partnership to support TB awareness and treatment programs. In addition, I will continue to amplify the voices of TB survivors and fight against stigma and discrimination, and ensure that women, children, and marginalized groups have equal access to TB care. I encourage every Nigerian to join in this fight. TB is curable. Early detection saves lives. Let us work together to remove the stigma surrounding TB, encouraging testing and support those affected. TB is airborne, and since it is contagious, I urge every one of us to get tested, know your TB status, and encourage your loved ones to do the same. If you have a persistent cough for more than 2 weeks, do not ignore it, but rather seek medical help immediately. Finally, I commend the Stop TB Partnership Nigeria, the National Tuberculosis and Leprosy Control Program, Federal Ministry of Health and Social Welfare, and all our partners for their relentless effort. To our health workers, volunteers, community and religious leaders, your dedication is the backbone of this fight. I thank you. I would like to inform His Royal Majesty, Alhaji Dr. Usman Nga Kukpi, the Sakpeyi of Gariki, that the Honorable Minister of Health, of State for Health, has assured me, after you made your request, that your request will be attended to. Not attended to, is already granted. So your community will soon be having their own primary health care center very, very soon. So, and I've also spoken to the Mandate Secretary on Health in FCT to inform the Honorable Minister of FCT that they should have also health center in addition. Thank you very much. At this juncture, I would like to pledge an additional sum of 1 billion naira from the Renewed Hope Initiative towards the fight against tuberculosis in Nigeria. Yes, we can end TB by 2030. We fit do am. Together, let us make the dream of a TB-free Nigeria a reality. God bless the Federal Republic of Nigeria. Thank you.